Hola, bon dia. Carl Munson here on the Good Morning Portugal live stream. And we're here to bring you the latest information about the COVID-19 coronavirus update here in Portugal in English. And we put this out on YouTube as well if ever you want to catch up with that information. And we're also a podcast too. Go to goodmorningportugal.com. For all the connections to all the information that we're working on. And as you can see there, the Facebook group is Stay Positive Portugal. So let's start with the global numbers. And I'll just share the screen with you so you can see that the links to all of the information sources I use are on the goodmorningportugal.com website as well. So let us have a look at the numbers around the world first before we focus in specifically on Portugal. And coronavirus cases are, globally just nudging their way up to 200,000 with just under 8,000 deaths across the world. And that lovely figure that we see of over 80,000 people now, nearly 83,000 people have recovered from the virus. And let's go specifically to Portugal to see the latest data for Portugal. And as you can see there are 448 total cases. Currently, 3 people have recovered, and there are so that would leave 444 active cases with the one fatality, sadly, that we've had in Portugal. 18 people of the cases reported there are in a serious or critical condition. So it would appear that it's the social distancing, the self-isolation is a good precaution to take at the moment. And in part 2 of the show, if you want to let us know how you're doing, how you're coping with that, I think it's quite a good time to stick together and to work together, even though we can't be in the same room, as it were, anymore, or the same place, pretty much, the same locality. We're using this sort of technology to stay in touch with each other. And I see lots of outbreaks of community spirit using social media, which is a lovely thing to see in quite challenging times. So let's have a look at all the information that has been shared recently by Safe Communities Portugal, which is a really good source of information. If, like many people, you're feeling a bit overwhelmed by so much information and you want one reliable source, I would recommend safecommunitiesportugal.com. Excuse me, I'm going to have to touch my face. Do excuse me, the land border. I will wash my hands afterwards, and it's only me in the room. 17th of March, this was yesterday in the morning, and the confirmation of the land border between Portugal and Spain closing, if you didn't know that. Following I'm not sure what, there's a bit of a typo there, but for the safety of all, the land borders between Portugal and Spain closed from 11 o'clock in the evening on Monday. And the 9 authorised crossing points, should you want to know them or tell anybody else, are Valença in Viana do Castelo, Vila Verde of the Rei, Verín. I won't trouble you and punish you with my terrible Portuguese pronunciation, but I'll just read through the names of the crossings. Tui, Verín. Actually, no, what I'll do is I'll give you the district crossings. That's probably the most useful thing to do. Viana do Castelo, Bragança. I don't know what keys means there. Guarda, Castelo Branco, obviously White Castle. There's some things being lost in translation. Porto Alegre, a couple of crossings there. A Beja crossing, a Faro crossing. And the question remained, who was allowed to travel, or who is allowed to travel between Portugal and Spain? The borders remain open for international transport of goods and transport of cross-border workers. I suspect especially people who are key to recovery and medical staff and so on. Entry of national citizens and residence permit holders in their respective countries. So yes, Portuguese people will be able to return home. Portuguese citizens will be able to return home, and likewise Spanish citizens. And obviously there, the exit of citizens resident in another country. So if you need to get out, you can go. If you need to get back in, you can come back in. But the clampdown is happening for toing and froing across the border, as it were, or spouse or similar and family members, exceptionally for family reunion. So there are some cases there, some subjective cases if you do need to see family as well across those 9 border points. So yeah, that's the real confirmation now that the border between Portugal and Spain is closed. And there is a link. Actually, I'll post that in the on the screen at the moment so that you can get more information if you want to. This is the Good Morning Portugal live stream with me, Carl Munson, doing my best. Really tired this morning, actually, but doing my best to have a service for you to share with you what's going on in the most factual and informative way in the first part of the show. And then I think it's really important to have a social aspect as well, to connect. And if you've got something you need to say, share, stay tuned for that, and we'll do that together. We'll slow the pace down for the second part of the show, and I'll just put the news and information part up on YouTube, and we'll use the rest of this show to connect and chat if anybody wants to do that. So thanks for everyone who has joined me this morning. Yes, there are so many cliches around at the moment, aren't there? The word unprecedented for one, and the phrase "we're all in this together," but we really are all in this together. And do please feel free to use this as an opportunity to connect in a way that is quite difficult at the moment to connect. So let's have a look. Certainly connecting physically at 1 o'clock, 1300 hours yesterday. According to the bulletin on the epidemiological situation in Portugal released at midday, yes, there are the numbers there that I mentioned to you. What I didn't say, that there are over 4,000 suspected cases and awaiting laboratory results in Portugal at the moment. And the link on the goodmorningportugal.com website will take you to the DGS site where you can see the Portuguese numbers. The GNR detected on Tuesday morning yesterday at the border post in Quintanilha a truck driver with symptoms related to the new virus. So that sort of checking is going on. After contacting the SNS, that's the NHS equivalent, if you're a Brit, 24 line, the man was referred to hospital in Bragança for further evaluation. So that sort of checking is going on, which it could be reassuring. Spain has registered 11,178 people infected with the coronavirus, and that is an increase of nearly 2,000 people on Monday, with 491 deaths due to the disease, 150 more since Monday, according to data updated by Spanish health authorities. The Directorate General DGS determined yesterday that public service establishments must establish measures to ensure distance between people. And you may have noticed this if you go shopping, the queuing is spaced out and only certain numbers of levels of people allowed into shops at any time. According to a DGS guideline published yesterday, it is recommended that in addition to respecting the rules of respiratory etiquette, such a great turn of phrase, isn't it, and sanitary measures, public service establishments should prepare their contingency plan for the pandemic and implement measures to ensure distance between people on the premises. Some people are just closing instead. In many ways, it's easier, isn't it, in terms of health contagion and so on, but a crushing blow to their economic prospects, and we'll give you news on how that's being managed as soon as I can. Among the suggested measures are the reduction to 1/3 of the capacity of the establishment's waiting places, the guarantee that the counter service is done at least 1 meter away, and the implementation of signs through brands and signs on the floor. Okay, so yeah, in my local pharmacy, for example, yeah, there is a 1 meter line that you're not meant to cross, and only a certain number of people allowed in the shop. And signage is good, but although it will be in Portuguese, of course. So if your Portuguese isn't good, just approach with caution, stay well back, and you will notice that the reduction in numbers is in place. So just be wary of that as you approach any commercial premises. DGS also suggests that physical barriers be created between employees and users in order to avoid excessive approximation between individuals, and that direct contact is kept to a minimum. With regard to the rules for cleaning and sanitizing, DGS recommends disinfecting at least once a day from all areas and at all hours of critical equipment, such as password dispensers or ATMs. Yeah, it's good to do a sanitizer squiz if you've been using an ATM, which I did last night. To these measures, he adds, should be added the placement of antiseptic alcohol-based solution in strategic locations. Don't worry, not a dry cough there. And to these measures, he adds, should be added the placement of antiseptic alcohol-based solution in strategic locations. Didn't see that by my ATM. Take your own if you can, and improvise. Certainly here at home, we've got a homemade sanitizer now, and there are lots of recipes for those, but they're worth sharing as well, I think. But yeah, stay away from it as much as you can, I think, is the best advice. And if you have to go implement those measures, would appear to be the overwhelming advice at the moment. DGS also, it reiterates through this standard that establishments must be proactive in identifying cases of priority care, such as the elderly, pregnant women and children under the age of 2, remembering that they are the people most affected by COVID-19. And that the establishments must take an active role in their protection. And I think that should extend to all of us, really. There you can see that a lot of hotels and accommodation facilities were giving their rooms to people who are unable to return home in the healthcare profession, which is an awesome thing. Lovely to see that sort of putting together, as well as the round of applause that seems to be happening at 2200 hours as well. People going to their balconies in grown-up areas just to give a round of applause. I think it's very moving, actually, just to have an outbreak of acknowledgement and applause from balconies and from windows of the health service workers. So final piece of news that was released by safecommunitiesportugal.com. There you can see the website and how they're keeping us abreast of this situation. The situation in Navarre is under a geographic quarantine as of 8 o'clock last night. A state of calamity was declared in Navarre. I'm sure that's a translatable translated phrase there that gives us state of calamity. And the municipality will be closed this Tuesday, not just Tuesday, I'm sure, from Tuesday, coming under geographic quarantine after the decision by the Regional Health Authority. The government is finalising this as a decree. All commercial establishments and non-essential services will be closed in Navarre, and the movement of people in that territory will be limited. The document and this year decree is valid until the April 4th. Cabrita, the Minister of Health, explained this Tuesday, that was yesterday, in a press conference, to the declaration of the state of calamity in the municipality of Navarre, restricting economic activities and the circulation of people. So that's a bit of a heads up, isn't it, to other places where the contagion may get to that level. Things will close down further. So worth getting appropriate levels of food and making sure everyone else is cool and good and looked after in your neighborhood should it go to that sort of level. Marta Temido says that the zone is compatible with a framework of active community transmission, and therefore there is a risk of widespread transmission of the new coronavirus and of the new transmission chains. 30 confirmed cases there as a result of these 444 contacts already identified and being monitored, which is also a good thing. There's active tracking down of people who've been in contact in these transmission chains, and they're being monitored, and their recommendations for isolation. We are facing a high number of confirmed cases in a restricted geographical area with many contacts. 50% of the cases of the Regional Health Administration of the centre are in that region of Navarre there. Measure which will be applied immediately and enforced until April the 4th provides a further restriction on economic activities and the circulation of people. It is forbidden for residents to leave the city and forbidden for anyone to enter except in exceptional situations involving health professionals, help and security forces. So if you have any business or family in Navarre, be aware of that. All commercial or industrial activities are prohibited except for those related understandably to the food sector. Therefore, all restaurants will be closed, leaving only bakeries and supermarkets open. Pharmacies, banks and petrol stations will remain open, as well as hospitals, health centres, relief structures and security forces, and water and energy supplies. So that's the situation in Navarre, perhaps the most seriously affected place in Portugal at the moment. So I think it's probably right now to switch to a more leisurely pace and give you the opportunity to say anything you want to say. Connect up via this facility.